If your baby was born with a cleft lip, here is what cleft repair actually involves, step by step. A cleft lip is a gap in the upper lip that forms very early in pregnancy when facial tissues do not fully join. Clefts vary. They can be on one side, both sides, partial or complete, and about half also involve the palate. Repair is done for function, not just appearance. It supports feeding, speech, facial growth, and dental development. Most cleft lip repairs happen between 3 and 6 months of age, once the baby is healthy and feeding well. For wider clefts, gentle taping or molding may be used for weeks beforehand to bring the lip edges closer. During surgery, the baby is asleep under general anesthesia. The surgeon reconnects the lip muscle, lining, and skin in fine layers. Many surgeons also lift and reshape the nostril cartilage during the same operation, called primary cleft rhinoplasty. The operation usually takes 1 to 3 hours. Most babies stay in hospital for 1 or 2 nights afterwards. Early recovery focuses on comfort and protecting the wound. Soft arm splints stop the baby from touching the lip. Swelling settles over 2 to 3 weeks. The scar starts pink and raised, then softens and fades over many months. Cleft care is a journey. Palate repair, hearing checks, speech therapy, dental work, and later refinements may follow. Risks include bleeding, infection, wound separation, and asymmetry. The team explains these in detail before surgery. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.